Thank you, Mr. Chairman, and thank you for choosing this topic. I'm particularly interested as the co-chair, the founding co-chair of our Congressional Task Force to combat the heroin epidemic, and I appreciate this testimony. This afternoon, we are again examining VA's role in ensuring that prescription drugs are safely controlled in VA medical facilities. Less than a year ago, former Chairman Kaufman and I held of the O&I Subcommittee on this very issue in Colorado because the Drug Enforcement Agency, DEA, found several violations in the Denver VAMC. We continue to hear disturbing reports in hospitals and clinics in our communities that some healthcare employees are stealing controlled substances for their own personal use or personal gain. We know that these cases are on the rise throughout the country. One healthcare employee diverting controlled substances can be a serious public health risk and can cause significant harm to many patients. We learned this lesson the hard way in New Hampshire with a technician who was injecting himself with fentanyl at a hospital in Exeter, New Hampshire. But it turned out this had started at the Baltimore VA Medical Center and continued in more than a dozen hospitals in other states, infecting up to 50 patients in our community with hepatitis C, and some of these patients were veterans. From this example, it is clear that the nationwide trend of opiate diversion also impacts our VA. The VA health system is one of the nation's leading prescribers of opioid medication. Diversion in the VA threatens the safety of veterans and hampers efforts to address the opioid epidemic in our communities. Preventing diversion of these substances should be a paramount concern. That's why I find the GAO and IG's findings particularly troublesome. It's unacceptable that some VA medical facilities are not conducting routine inspections to prevent and identify drug diversion. Background investigations that could potentially identify finding employees who have diverted drugs or who may have a drug substance use problem were backlogged in Atlanta. Healthcare employees at the Atlanta Medical Center were not subject to drug testing for 6 months, which could identify diversion of prescription drugs. We need to get to the bottom of why these safeguards and processes are not being followed. I want to know if the procedures, when followed, would work to prevent drug diversion, and I want to know if VA has the resources it needs to conduct the inspections, the background checks, and to administer its drug-free workplace program. I'm also concerned about the VA hiring freeze that's currently in place, and that VA HR employees are not exempt. The GAO and IG identified that staff need more personnel and more training to properly conduct these inspections. They also identified the need for more HR personnel to address the background check backlog in Atlanta. Without adequate support staff in place, VA medical facilities will continue to struggle to comply with the procedures and programs that they must follow to ensure that our veterans receive safe care. Finally, I look forward to learning about progress at the VA with regard to the opioid safety initiative that we passed within CARA, the Comprehensive Addiction and Recovery Program, just last year to bring down the rate of opioid prescriptions for all of our veterans. We must do everything we can to help veterans suffering from chronic pain and to help veterans struggling with substance abuse and addiction. The opioid epidemic is destroying the lives of veterans and their families in communities across New Hampshire and all across the country, and we need to work together to find innovative solutions to end this epidemic. As I say to my colleagues, the heroin does not choose R's and D's. We together, and we are proud champions of the Comprehensive Addiction and Recovery Act that we passed last Congress. I look forward to hearing about VA compliance. Thank you, Chairman Burke.